Welcome back to News 3 today at 11. The opioid and fentanyl crisis in America is at an all-time high, and the coastal empire and low country are not immune. In October of 2017, the U.S. Department of Health and Human Services declared the opioid crisis a national public health emergency. According to the Centers for Disease Control and Prevention, more than 107,000 people in the United States died of a drug overdose in 2023, with roughly 75% of those deaths involving opioids. According to the Georgia Department of Public Health, the total number of opioid-involved overdose deaths in the state increased by an astonishing 302% from 2010 to 2022. Opioids, specifically fentanyl, appear to be driving these increases. From 2019 to 2022, fentanyl-involved overdose deaths in Georgia increased by 308%. Now, to put that into perspective, that's 1,601 lives lost in 1 year alone. But the numbers tell only a part of that story. As work continues to curb this epidemic, healthcare professionals must confront the unique treatment challenges posed by fentanyl. In the Savannah area, the New Season Treatment Center offers outpatient services for opioid addiction issues. Darrell Lee is the agency's community liaison of the Southeast Region Support Center. He joins us now with more. Wow. Thank you so much for being here.
Yes, ma'am. Thank you for having us here.
Listen, these numbers are staggering, but you stand on the other side of these numbers, and that's with treatment, helping people get help.
Absolutely. And what we want to do is we want to combat the opioid addiction, but we want to do it with counseling services, where we're going to start building back coping skills with each patient. We do it with medication-assisted treatment that's doctor-led, and we do it with compassionate care. The thing that we see is in joining in and creating community partnerships so that we're able to connect, because a lot of times we will identify other needs a patient has, and that way we're able to reach out. We're going to meet and individualized treatment plans, and we're going to love and support the patients and meet them where they are.
Now, this facility was new to me, but you've been around for a while.
Yes, ma'am, for the better part of 10 years. So we have been, like you said, outpatient treatment and with the counseling services. So what we're doing now from my position is making those community partnerships, because we have to realize that everybody that walks through our door or another facility's door may not be the best fit for our facility. So we want to reach out and connect them for those other services they need.
And we also have to realize that over the last 20 years, drugs and drug use has changed.
Yes,
I mean, we went from the 60s and 70s with heroin and cocaine, and the 80s and 90s with crack, and now we have fentanyl, which is totally different.
Yes, and where you're looking at fentanyl is rated at 50 times stronger than heroin, 100 times stronger than morphine. And when we talk about meeting patients where they are, I've heard so many come in and say, I'm just an addict. And we have to build and support them and say, no, you're somebody who life happened to, okay? We'll deal with why it happened. We deal with making sure it not happen again, but right now we're going to start your treatment, and we're going to stop curbing your withdrawal symptoms, curbing your cravings, and start helping.
And we've heard a lot about the use of, is it methadone?
Yes, ma'am.
Decades.
Yes, ma'am.
Right?
Yes, ma'am. Which we have in our centers, we have methadone, buprenorphine, or Suboxone. And what that's going to do is we want to get them to a point of blockade, where that the methadone is binding those sites, where it's curbing those cravings, and it's helping them move away from that illicit drug. Now, they can reach, when they reach blockade, they can start titrating down under a doctor's supervision as the counseling services are building and helping them support in the other areas of their life.
Now, you provide in-depth services. I know a lot of people watching are wondering if they can afford the treatment. There are several ways that you can pay for this treatment.
There are, yeah. We Medicare and Medicaid, a lot of third-party insurances. We do have some grant availability that comes through the state, and some of that grant availability even helps with some transportations for those patients, because that's an issue too. And so we're always looking for new ways to help fund that. We do have the self-pay option if they don't have any of that, and we work with them on that.
Okay, and if people want to find out more about you, you're holding an open house tomorrow.
Yes, ma'am. 145 Southern Boulevard, Suite B, is from 11:30 to 1:30, and I see it up on the screen.
See?
Our helpline number is 24/7.
Okay.
Is 877-284-7074.
All right, Darrell Lee, thank you so much for joining us
Yes,
today.
ma'am. Thank you so much.
All right. And right now, you can go to wsav.com/opioids to find out more. And we also have our crisis hotline that's available 24/7 as well. With all of the things that Darrell talked about, you can call that number by going to our website, wsav.com/crisis hotline. Right now, throughout the day, News 3 will take a deep dive into this growing issue. In the meantime, if you or someone you know is struggling with addiction, you can visit our website.